Hello, I work for Human Right to Water and we protect the human rights to water and sanitation through law, policy and advocacy. We've recently started research on the topic of menstrual health management as a human right, and I'm very pleased to introduce you to Sophie Hickling, who is the Senior Policy Analyst at WaterAid for Hygiene. Hi, Sophie.
Hi, Amanda.
I know that WaterAid's been working on menstrual health and hygiene for many years. Perhaps you can explain the link with water and why you think this is, or see this as really important.
Thanks. But I think answering the first part of your question, the last part of your question first, I think the numbers really speak for themselves. The fact that every month more than 500 million women and girls globally don't have what they need to manage menstruation, which is a completely normal and healthy fact of life, is absolutely staggering. One of the central pillars of women and girls and others who menstruate being able to manage their period is having appropriate water, sanitation, and hygiene facilities available to them, whether that's at home or in school or in their place of work. And these are just the kind of basic necessities that mean that women and girls can wash their bodies and their hands and change menstrual materials and or dispose of used materials in privacy. I think if we take schools as an example, having water and soap to wash hands or to clean reusable products, as well as having toilets to provide privacy, is essential. However, we know that the world is really off track from reaching targets in school wash. In sub-Saharan Africa, for example, more than half of schools don't have a basic water service. Half don't have adequate sanitation, and 3 in 5 don't have hand washing stations with soap and water. And globally, less than a third of schools put that little bin in the girls' toilets for disposing of menstrual waste. And that's a situation that contributes to girls missing out on education. Earlier this year, UNICEF reported that between 2016 and 2022, more than 10 million adolescent girls across 41 countries missed out on school or other activities during their last menstrual period. But if menstrual health and hygiene needs are met, which includes having clean water, having toilets, hygiene services, sanitary products, accurate information, girls can stay healthy, they can feel confident, and they're more likely to stay in school. And in workplaces as well, by providing water, sanitation, and hygiene facilities that support menstrual health, businesses are likely to see a reduction in absenteeism and sickness, and they're more likely to see a boost in productivity and boosted staff retention levels. And I think as a last point to make here, menstrual health and hygiene is central to achieving multiple sustainable development goals, but not least target SDG target 6.2, which is access to adequate and equitable sanitation and hygiene for all. And that one refers specifically to paying attention to the needs of women and girls. So it's really important that governments establish an environment where homes, workspaces, schools support menstrual health, including by having wash services and the right information available.
Yeah, and interestingly, talk about menstrual health management is taboo in so many places and countries, and it's embarrassing for people to discuss openly. Even in our own country, in the UK, it's still they blush when you talk about it. Do you think that this is the main problem that we have to address first, the ability to be able to speak openly about it?
Yeah, I think the taboo and stigma associated with menstruation is definitely an issue. Obviously, be fresh in the minds of your listeners at the moment, as we've just had Menstrual Hygiene Day on the 28th of May. And that's an excellent way to raise the issue to a wide audience and bring attention to how a lack of menstrual health and hygiene means that women and girls and other menstruators are held back from reaching their potential. And I think another way to start shifting how menstruation is perceived is to make sure that factual and pragmatic information is available. For example, by having it taught in schools. If both boys and girls are given the facts in an age-appropriate way, it helps to build a narrative that this is normal and it's a healthy part of life. So getting menstrual health and hygiene embedded in school curricula is a great start to shifting the taboo. And there's other ways too. WaterAid has been working to raise awareness in communities as well as schools. And a really nice example from our country programme in Nepal, we've used participatory photography to address menstrual taboos. So this is an approach where girls use photography as a way to express their own individual experience. And it's so important that girls can tell their own stories about how a lack of menstrual health and hygiene impacts them, and for their communities to be able to respond to that. And then another way our Nepal team are working is to work with a fellowship of women journalists to report on the challenges of menstrual health and hygiene. And again, getting menstruation discussed in the mainstream media is such an excellent way of tackling taboos and the stigma that surround it.
Yeah, and it sounds like those are really creative programs as well, which appeal to a much wider audience, which is really important too, isn't it? And as we know from our own work at Human Right to Water, there are very few guidelines and policies in place today on this matter. The challenge is huge. Your examples are great, but there are very few of them elsewhere. So what do you think are the first steps in trying to address this issue around the policies, that is?
Okay, well, I mean, I think firstly, it is really important to acknowledge that there has been some huge progress already. Many countries, if you look at Kenya, Canada, Sweden, to name just a few, the policies and guidelines are being put in place to address menstrual health and hygiene. And there's also growing recognition of the importance of menstrual health to public health and to gender equality, human rights, global development goals. In the last few years, we've seen the adoption of a comprehensive definition for menstrual health, which has supported wider multi-sectoral approaches. We're seeing menstrual health and hygiene being included more in global agendas. For example, the 2021 Human Rights Council resolution, which focused on menstrual health, gender equality and human rights. And in that resolution, among other actions, it called upon states to ensure that women and girls have access to adequate facilities, information and products for optimal and effective menstrual hygiene management. I think there's also, it's good to refer to the work that's also underway to define ISO standards for menstrual products for their safety and for their quality. Mm-hmm. But I think going forward, there are three important areas to build on. And firstly, I think making sure that menstrual health and hygiene is integrated comprehensively in policies across all the sectors that it touches, including WASH, but also in education policies, health policies, gender policies, workplace policies. Secondly, I think policies need to be evidence-based and informed by data. We need to ensure that we're learning from policy implementation and that learning is being captured and shared, and that we work as a sector to identify and address evidence gaps in menstrual health. And we need to ensure that indicators for menstrual health and hygiene are being included in national and subnational monitoring surveys so that implementation of policies can be tracked in terms of real change, including and especially for the hardest to reach populations. I think really having that information available for decision makers is essential. Yeah. And then most importantly of all is the focus needs to be not just on getting policies in place, but we need to see increased and sustained investment across sectors for equitable policy implementation so that policies have the intended positive impact on the lives of women and girls and others who menstruate. Yeah. It's certainly a challenge, and I think it's got a long way to go, but it's been great that in the last few years, and it really is only in the last few years that we've seen a lot of this progress and more attention being put into this area. So I'm excited to hear how things go, and I'm looking forward to working with you also in the next few years on this topic. Thank you so much, Sophie, for coming in to talk to us today, and we look forward to talking to you again.